My name is Nidhi Yadalam, and I'm a rising senior from JHU High School in Portland, Oregon. Today, I'm excited to walk you through how we can use AI and biology to better understand, detect, and predict the movement of lung cancer known as metastasis, one of the most deadliest diseases in the world. Here's a little bit about myself. I'm in 12th grade and I've always been fascinated by how biology and technology can come together to solve the most complex problems in healthcare. Outside of school, I'm heavily involved in science research, presenting at fairs and conferences, or just diving into new topics that I'm really interested about. I'm also a leader in Oregon HOSA, which is a healthcare career organization for students. Most of my research work focuses on two big ideas: how cancer like diseases actually behave in the body, and how we can design better, smarter, and safer ways to treat them more efficiently. In the future, I hope to keep combining research and medicine to create solutions that are not only effective, but accessible to people no matter where they live. So here's the problem: lung cancer. It's the number one cause of cancer related deaths, killing more people than breast, colon, and prostate cancer combined. In just 1 year in the US, over 125,000 people died from lung cancer. And what makes it so deadly is this phenomenon known as metastasis. It's when the cancer spreads to other parts of the body, such as the brain or the liver. Now, here's really the challenge: metastasis is very hard to detect early. The tools that we use today, like scans or biopsies, are often invasive, slow, and miss the key signs. And for people around the world, by the time these therapies actually dole out, it's just too late. That's why this isn't just a medical problem, it becomes a global health problem. We need new ways to detect and treat metastasis that are precise, affordable, and easy to scale, no matter what the issue is or where it's happening. And this is what I did. I combined two amazing tools: spatial transcriptomics and lipid nanoparticles, or LNPs. Transcriptomics. It's kind of a fancy name, but here's how it works. It's like taking a Google Maps of a tumor. It shows you where and which genes are turned on or off inside a tumor sample, helping us understand what parts of this tumor are most effective in spreading the tumor and making the metastasis happen. Now, lipid nanoparticles on the right side, these are tiny fat bubbles that act as delivery vehicles. They carry RNA based medicines into cells safely, kind of sending a secure message straight into a cancer cell. But what's inside of the bubble is just as important. The RNA that I use is designed to shut down cancer driving genes. Once inside the cancer cell, the RNA degrades the target, breaking down the actual cancer related genes. It stops the bad guy from doing their thing. Now, here's how the full project came together step by step. Data preparation. I started by collecting spatial transcriptomics data from real lung tumor samples. I cleaned and processed the data so I can map out how the genes were behaving across the tumor's landscape. And now the machine learning for metastasis prediction. Using that spatial gene data, I was able to train a series of machine learning models which were able to recognize and predict the gene patterns that were related to metastasis. The goal was to create this risk scoring system that could tell us, hey, this region is likely to spread. Pay attention here. And then I built therapies. I used computer models and my own machine learning models to design the ideal lipid nanoparticles to deliver gene therapy. I optimized various characteristics to make sure they would be stable, safe, and efficient to carry this good RNA to degrade the bad RNA. And validation. I had to make sure my model worked, so I approached a university with a lab that focuses on a lot of my work and synthesized my drugs and delivered it into real life cells. So now that I have my model, I have to test it to see how it works. I did this using two systems. One known as in silico validation, which uses computer aided simulations that I built to test whether the metastasis outcomes are actually true. So my model was able to spot high risk tumor regions with over 95% accuracy. I found this through external validation with clinical metastatic outcomes. I was also able to draw novel conclusions such as where in the tumor the metastasis was exactly going to occur, given the tumor sample, ideas that have never been proposed before in the field. Number two, in vitro validation. After synthesizing my particles and administering them to cells in the lab, I performed this in vitro validation. I found that the nanoparticles that I designed were the perfect size to enter cells, had great RNA protection, caused almost no immune cell reaction in cancer cell tests, and kept the cells healthy, meaning low toxicity. In short, my models worked, both in computer simulations and in the lab-based settings. So what did we actually do here? In my project, I found the most dangerous parts of the tumor and marked it before it spread. I designed smart, gene delivering nanoparticles to treat these parts of the tumor and prove the idea worked in lab based and computer simulation models. But here's why this project and this research matters on a global scale. Cancer affects everyone everywhere, unfortunately. But and we know that personalized treatments are expensive and out of reach for many. But by using AI and computers, we can speed up this process of drug design, cut costs, and make these custom, personalized, laser focused therapies scalable. This could lead to treatments that are affordable, safer, and designed for each and every person, and extremely safe. Just as a final thought, imagine if people facing the most aggressive, life threatening cancers didn't have to wait years for a treatment that fits them. With tools such as AI and smart delivery systems, we can design precise therapies tailored to each person's cancer faster and more affordably than ever before. I'd like to extend my deepest gratitude to the Global Health Leaders Conference at Johns Hopkins University for giving me this excellent opportunity to present my work. I'd also like to thank the Oregon State University and the Oregon Health and Sciences University for giving me a platform to conduct my research. And last but not least, my parents, teachers, and mentors for all of their help, guidance, and support through my journey. Thank you so much for listening to me today. If you have any questions or would like to reach out, feel free to connect with me through my email or LinkedIn. Thank you again for your time and have a great rest of your day.